The latest on the flu epidemic getting worse, as you know. The CDC says there have been nearly 9,000 confirmed flu-related hospitalizations. That is almost double the number at this point last year, and this is really taxing the hospitals all across the country.
That's right, Robin. Hospitals and medical offices filling up with people suffering from the flu, and fears of it spreading are also on the rise. So doctors and patients are turning to a high-tech solution: office visits without the office.
As more people get sick, the risk of infection growing. Hospitals with ER beds overflowing, now canceling elective surgeries to keep beds available for new flu patients. Plus Tamiflu and IV bag shortages, and hospital staff working overtime.
People are definitely working over, doing double shifts, coming in extra days. There's definitely staffing issues throughout the hospital, especially with as full as we have been.
With some doctors urging people not to flood the ER unless they are really sick, and some patients worried they may catch something if they do. Virtual doctor visits are booming. Patients getting a flu diagnosis, and in some cases, even Tamiflu prescriptions right from their smartphone.
We can send it directly to your pharmacy, and you can pick it up within 30 minutes.
New York Presbyterian Hospital in New York City has NYP on-demand virtual urgent care.
This is an intimate encounter where they're one-on-one with the patient versus being in a crowded emergency department or waiting for hours in a doctor's office.
The Doctor On Demand app costs $75 for a 15-minute consultation for the uninsured and can treat a range of non-emergency conditions. This flu season has been big for them.
Because this has been such a big flu season, we've seen over a 100% increase in our total visit volume. About 1 in 5 of our cases are actually flu-related cases or cold-related cases, and so they end up getting a prescription with Tamiflu.
Too sick to leave home? When her 2-year-old got sick, Lisa Maciel used an Uber-like app called Heal.com to send a doctor right to her home.
This is so convenient. We can just stay home. It was just so easy.
As you saw, these apps are not free, but all of them tell us they work with insurance companies. Doctors On Demand, $75, as you heard in the piece, says they work with large and small plans across the country. NYP On Demand costs $99, but they say insured patients may be able to submit a claim and get reimbursed. Heal.com, also $99, says they accept many major PPO plans. So good idea if you have insurance to check with your carrier beforehand and see if you're covered. And one more thing that can't be said enough, it is not too late to get your flu shot. I took my daughters just yesterday. All 3 of us got our Wonder Woman Band-Aids. I just took mine off this morning. So if you haven't already, get yours now. It's not too late.
It's not too late. I know. Dr. Amy, now Dr. Jen. And you've been saying all along it's not too late. It was great seeing the girls like that. People also want to know, Jen, there's so many questions that people have, that if you get the flu and recover, is it one and done, or can you get it again?
So yes and no. You cannot get reinfected with the same strain, and over 80% of the circulating strain this year is that type A H3N2. You cannot get that twice because your body makes antibodies to that, but you can get infected with another strain. Less likely, but it is possible.
And when can you spread the flu, even when you don't have symptoms?
This is the really important thing, George. You can be contagious one day before your symptoms start, so you can be at work or school feeling fine and infect others, and your symptoms can last up to 7 days after they begin. So people might start to feel better day 5, go back to work or school, and be contagious. So keep those numbers in mind.
Okay, but how do you know if you have the flu or if you just have a cold?
That's the million-dollar question. So I want you to look at this graphic. It's one of my favorite things from math. It's called the Venn diagram, and you see in the middle the overlap in symptoms. Cough, runny nose, sore throat, you can have those in both. The key thing with the flu, it's sudden onset. It really comes on fast. You tend to see high fevers, and those symptoms go below the neck, body aches, chest pain, all of that. So it's pretty impressive.
Can I ask you another question about that? Because my little daughter got a sudden fever. We did the swab, we took it to the doctor, and she tested negative.
Yeah, I mean, remember, there are other circulating viruses that can give you fever, and not everyone with the flu develops these severe symptoms. So some people can have very mild symptoms, think it's just a cold, go to work and school, and infect others.
How effective are the flu shots that I just got? I know it takes like 2 weeks, right, before you actually get full protection?
2 weeks for the full protection. There is some data that people start to see some immune benefit in a week. We won't know the efficacy of this year's flu shot until after, but it's appearing to be around 30%. 30% better than 0%.
You know, Lara hasn't been feeling well, and she decided to come in today, and our executive producer took one look at her and said, go home. And
we have a smart executive producer, and hats off to Lara for going home.
But hands off that also she has a job where she can go home and still get paid.
That's right.
There are a lot of people,
that's right.
That's not the case for
the bosses have to step up.
Yeah.
Well, our same executive producer we sent home last week.
You're right.
Not really. True. Thank you, Jen.
You bet.